Assalamu alaikum, Ultrascan Diagnostics. Say this is the CBCT of the patient that you had requested. The area of interest is the lower arch for implant. On the panoramic view, you can see we've got periodontally compromised and BTRs with periapical radiolucency in the anterior segment. And we have a bilateral edentulous area. Now we're going to place implants based on the most ideal locations. Just to give you an idea, the anterior segment, however, is not very well supportive of implant because the ridge is extremely thin, as you can see right here. The ridge is quite significantly thin right here. This is the central incisor region. You've got a periapical radiolucency, you've got thinning of narrowing of the neck of the ridge. Again, very thin ridge here. We've got an extremely thin ridge on the lower left side. And even with these endo-treated BTRs, the ridge is quite significantly thin. At this point, we only have 5 millimeters of diameter, and that is from cortical to cortical plate. So this is something to be kept in mind. Then we will move on to the posteriors. We've got relatively thin ridges here as well, but since we've got good bone support, so we can attempt to place implants in these regions. So now we're going to go ahead and place implants for the doctor. Sorry, my apologies. So this is the panoramic view, and these are all the implants that we placed in all the most ideal locations. These are all Megagen N1 implants. As you can see, if we place them in the lower canine region, the right lower premolar molar region, the left lower premolar and molar region. This is how the implants look on the yellow part is the prosthetic component. The lower left has thinner bone as compared to the lower right. So hence that should be kept in mind. We've placed in the narrowest is 3.9 mm of diameter, but if the availability of 3.3 mm diameter mini Megagen implants is present, so you can attempt placing those more comfortably as well. This is how the X-ray looks on the axial view, which is the top to bottom view. As you can see, that most implants are very well covered by bone. They're placed slightly lingually because of the buccal bone defect, but otherwise, this is the APC, not the top part. As you can see that we've got good clearance. The implants are relatively center of the ridge, and they are far away from any significant anatomical structures as well. So implant plan report will be shared. If there are any further questions, please feel free to reach to our team. Thank you very much.